I have a question for all of you. In your experience, what are the keys to getting this technology adopted in your institution?
So for me, I work in a community hospital, and the gastroenterologists that work out of our endoscopy lab are both faculty practice working for the hospital and doctors in private practice. And even though we have different practice settings, our goal is the same, which is to improve quality of colonoscopy. And the hospital has been very supportive of this. We have high definition colonoscopes. We really concentrate on bowel prep. We look at our withdrawal time. And despite doing all those things, even though that improves the colonoscopy, it still doesn't help us see blind spots, backside of folds. And so when you speak with your colleagues and discuss the data of the third eye retroscope, they're intrigued by it, they're interested to try it, and they've noticed that there's improvement of their quality of colonoscopy. In terms of the supporting staff, in terms of the nurses, they've also been very receptive to it, because I think deep down they know that colonoscopy is not a perfect test, and when you show them a tool that will improve colonoscopy, they adapt the technology quickly on their end, and it leads to a great patient experience.
Just to add, if I can, we're a similar community-based hospital, and we're split into faculty and private attendings. And initially the faculty was very receptive to adding third eye to our armamentarium for the colonoscopy, but the private were a little bit less responsive. And but they are receptive. And as soon as Dr. Gross came down to grand rounds, he actually came and presented his data, they were very much on board with adopting and adding third eye retroscope to the standard colonoscopy.
Well, with any technology, I see that you have your innovators, your early adopters, your late adopters, and some people who will never jump on board. And in our institution, we have 20 different endoscopists using our facility, and we still have some people who say that their way is the best way. They've been doing it for years, and they're going to keep doing it their way and not use the new technology. And it's been a challenge for me. We do not have 100% utilization at our center.
So I have had a similar experience about this, and my feeling is that one, as endoscopists, as physicians, we could always do better, and it takes some time for people to come around to realize that yes, you could do better, and then when you start to educate the patient, your consumer, and tell them that there's something better, no one's going to take the previous way to do it, and they're going to start asking for it. Patients today are very educated, they do a lot of research, and they actually know about the third eye retroscope. And so at my hospital, even the doctors that were pushing it off, they've also started to come on board. One, because I think they see its improved quality, and two, that the patients are demanding it. And with that combination, ultimately everyone gets on board, but there is a little bit of a lag.
Dr. Gross, how have you explained this technology to your community?
So when I look at spreading the word of colon cancer screening, the first thing for me is that I want everybody to get screened. The next job that I have is to use the best quality exam, which in my mind right now is the third eye enhanced colonoscopy, and I have to raise awareness. And awareness is raised two ways. One, I talk to my colleagues, referring physicians, not just gastroenterologists, the primary care physician, any physician that works in my network, I want to let them know. So I've given medical grand rounds. I've gone on this health talk show that a lot of my colleagues watch, as well as patients. The next step in that is that we have to raise awareness to the community at large. So how do we do that? So there is a marketing kit that I've received that helps me, but I give talks to the communities, I lecture, I do radio spots, I do whatever I can to get the word out, because I want my patients to be informed, I want my colleagues to be informed, but you have to do it in two parts. You can't just rely on one person to spread awareness, and I believe that there's a whole network of people we need to reach out to, and I've worked with the hospital closely to accomplish that. And so in my area, I'm confident that doctors and patients are well aware of the third eye enhanced colonoscopy.